In the northeast corner of Florida, nestled between Jacksonville and the Georgia border, lies a resilient community known for its charm and beauty, where small towns meet farm fields and sprawling oak canopies, and generations of families live, work, and grow together. Nassau County is made up of tight-knit communities, places like Fernandina, Yulee, Callahan, and Hilliard, each filled with a deep sense of pride shaped by its history, geography, and the strength of its people. But like many rural communities across America, Nassau County also faces a quiet challenge. In the county's quiet rural stretches, a growing crisis has touched the lives of countless families: Neonatal Abstinence Syndrome, or NAS.
Neonatal Abstinence Syndrome, or what we call is NAS, NAS, it kind of reminds us of what we used to call previously, refers to substance-exposed newborns, where what happened was individuals, parents or mothers, would use substances previously, and it would impact the child in the womb. And then what happens is, once the child is born, then they have some certain type of symptoms from the NAS. So it's like the child is almost kind of coming up withdrawals from the actual substances.
And in rural communities like Nassau County, barriers to care, from transportation to healthcare access to stigma, make it even harder to ask for help. That's where the Rural Communities Opioid Response Program Neonatal Abstinence Syndrome, or RCORP-NAS, steps in. In 2023, the St. Johns River Rural Health Network was awarded the RCORP-NAS grant to improve systems of care, family support services, and addressing social determinants of health in Nassau County.
These services offer a great deal of support for families. We are able to provide kind of wraparound services.
From the moment an individual or family first connects with an organization participating in the RCORP-NAS program, their journey begins with compassion and support, not judgment. The goal is the same: meet people where they are and walk with them on the path to recovery.
Because rural communities have their own unique set of needs and barriers to accessing healthcare. Healthcare from a hospital or a clinic or a provider may be very far away for them to travel. They may have transportation challenges. There's lots of evidence to support that folks will not travel over 40 miles to access healthcare. And then as far as the infrastructure or the lack thereof in rural communities, a lot of folks don't have access to broadband, so they don't have access to telehealth. Our driving purpose is to ensure that all individuals in all rural areas have access to health care. It's really those organizations like Starting Point Behavioral Health Care, Inspire to Rise, the Community Coalition Alliance. These folks are the ones that really do get the benefit of seeing their work affecting change and a positive outcome.
Still, even the best care can be out of reach if stigma gets in the way. Stigma doesn't just silence, it isolates. It turns moments of vulnerability into shame, which keeps people from getting the help and support they need. In rural communities like Nassau County, where everyone seems to know everyone, that stigma can be especially heavy.
Stigma shows up in community settings and also in professional settings because people don't understand sometimes the mental health or the substance aspect.
At the core of real change is understanding. When we grasp the reasons behind someone's struggles, it opens the door to empathy, not judgment, and creates a space for true support.
Yes, a lot of people judge individuals if they use substances, and that's one of the things where I think we were trying to make sure we eradicate. But at the same time, too, I think it's big on educating people about what's kind of going on, so they can kind of know, hey, just because a person has been using substances, or we had a substance misuse disorder, that's not the end of the road.
Some common misconceptions are that people chose this lifestyle, that they're always going to be like this, that they're never going to get better. But really, it's just one moment in their life. And do we really want to define people by one moment that they are not proud of? I know that I'm not proud of certain moments in my life. I'm thankful and grateful that those moments have not defined me forever, that I've been given the opportunity to become who I am today. And I think everybody should be given that opportunity.
In the county's quiet rural stretches, a growing crisis has touched the lives of countless families. Neonatal Abstinence Syndrome, or NAS. NAS occurs when a baby is exposed to opioids or other substances in the womb and is born experiencing withdrawal symptoms. These newborns may tremble, cry inconsolably, struggle to eat, and often need specialized extended care. NAS isn't just a medical condition, it's a crisis impacting our most vulnerable from their very first breath.
My name is Marcus Hill. I work for Inspire to Rise. I'm a program coordinator with Inspire to Rise. I'm also a therapist as well, too. Neonatal Abstinence Syndrome, or what we call is NAS, NAS, it kind of reminds us of what we used to call previously, refers to substance exposed newborns. Individuals, parents, or mothers would use substances previously, and it would impact the child in the womb. And then what happens is once the child is born, then they have some certain type of symptoms from the NAS. It's like the child is almost kind of coming up withdrawals from the actual substances.
For parents, the journey can be overwhelming. In addition to raising a child facing these challenges, many are facing struggles of their own, battling substance use, poverty, housing instability, or mental health challenges, often all at once. And in rural communities like Nassau County, barriers to care, from transportation to healthcare access to stigma, make it even harder to ask for help.
My name is Susan Gritch, and I am the Executive Director of the St. Johns River Rural Health Network. Rural communities, because rural communities have their own unique needs as far as access to healthcare.
That's where the Rural Communities Opioid Response Program Neonatal Abstinence Syndrome, or RCORP-NAS, steps in. Funded by the Health Resources and Services Administration, RCORP-NAS is designed to reduce the impact and incidence of NAS in rural communities. In 2023, the St. Johns River Rural Health Network was awarded the RCORP-NAS grant to improve systems of care, family support services, and addressing social determinants of health in Nassau County.
My name is Ann Schroth. I am a behavioral health therapist with a primary focus on working with clients that have been referred to us from the Department of Children and Family Services, primary focus on substance use. These services offer a great deal of support for families. We are able to provide kind of wraparound services.
In Nassau County, this effort is led by the St. Johns River Rural Health Network, working hand in hand with behavioral health providers, community organizations, peer mentors, and schools. St. Johns River Rural Health Network has partnered with key organizations across the county to coordinate care and deliver services, which are Starting Point Behavioral Health Care, Inspire to Rise, and Community Coalition Alliance. In addition, the network engages in resource sharing and collaboration with other organizations. Together, they've built a referral network designed to treat the whole person, not just the symptoms. It's a collaborative, community-based response to a complex challenge. It's about the community coming together to wrap these individuals in support and let them know they're not in this alone.
I am Flora Davis. I'm the Grants and Programs Administrator. One thing to completely understand is that you are not alone. That there are people here to walk with you. We will get through this together. There's a community here with you. And we will get through this together.
But how do you turn that commitment into action? In the next chapter, we explore how families and individuals first connect with the program, what kind of support they receive, and how RCORP-NAS is making a difference, one step at a time. From the moment an individual or family first connects with an organization participating in the RCORP-NAS program, their journey begins with compassion and support, not judgment. Whether they're referred by the Department of Children and Families, a crisis response team, or a local school, the goal is the same: meet people where they are and walk with them on the path to recovery. The work is carried out by numerous individuals working on the front lines of many RCORP-NAS partner organizations, and supported by the St. Johns River Rural Health Network and Executive Director Susan Gritch.
The St. Johns River Rural Health Network is actually one of 9 rural health networks established in state statute of Florida 381.0406. And the St. Johns River Rural Health Network serves 7 counties in Northeast Florida. And each of the rural health networks are devoted to providing access to health care for folks in rural communities, because rural communities have their own unique set of needs and barriers to accessing health care. One of the main ones is they are rural. So individuals who have health care needs in rural communities might not be able to access health care easily. Health care from a hospital or a clinic or a provider may be very far away for them to travel. They may have transportation challenges. There's lots of evidence to support that folks will not travel over 40 miles to access health care. And then as far as the infrastructure or the lack thereof in rural communities, a lot of folks don't have access to broadband. So they don't have access to telehealth. So those are probably some of the largest barriers to being able to access healthcare in rural communities.
The St. Johns River Rural Health Network serves 7 counties across Northeast Florida: Nassau, Baker, Clay, St. Johns, Putnam, Flagler, and Volusia. Nassau County sits in the far northeastern corner of the state, bordering Georgia. As Ann Schrouth explains, barriers to care persist throughout Nassau County.
Nassau County is a very large county, but it's very spaced out. And on the western side of the county, we find a lot of people don't get the services that they need, particularly pregnant women.
Nassau County faces a shortage of health professionals across much of its geography. Callahan and Hilliard are designated as Geographic Health Professional Shortage Areas, or HPSAs, for primary care, and a Maternity Care Target Area, meaning that there is a shortage of maternity care health professionals. Nassau County as a whole is designated as a high-needs geographic HPSA for mental health. Together, those challenges mean that to successfully meet the needs of people in rural communities, you need to meet them where they are. That means working with partners to bring services where they're needed most. Once referred to one of the community partners on the RCORP-NAS team, individuals are met with an arsenal of services to help them on the path to recovery, for themselves and their families. Ann explains how that support starts the moment they ask a team member for help.
These services would provide a great deal of support for the families, obviously the pregnant mom or the postpartum mom specifically, but would provide a great deal of healthy services and wraparound services. So not only having therapeutic supports, substance abuse counselor supports, we also have peer services, and the peer supports are able to go right into the home and meet with families so that they're able to feel well supported by not only our facility, but as also the community itself. And then the referral services help us with medical connections. So a lot of times with pregnant moms, they haven't had services yet. So we're able to refer them out to whether local hospitals or, OBGYNs, that they can be able to get that medical support that they need that is so critical because they are high-risk pregnancies in most cases.
Here's how Marcus Hill describes the approach.
We get a lot of different referrals from different agencies, from like the Florida Department of Health, DCF, and Jewish families, things of that nature. So I look at it as a big partnership. Yes, we get referrals from other agencies as well too, but this is kind of like honestly the heartbeat of us because we work together.
My name is Kathy Moore, and my title is the Prevention Supervisor. We have a system that we call the BRAVE system. We may get a referral from the school social worker, which I check, and we link them to the services here at Starting Point. They get 6 free counseling services, and whatever other services they may need are provided to the children.
That support often includes essentials like transportation, housing assistance, mental health counseling, harm reduction supplies, or even meals, whatever it takes to keep families healthy, safe, and stable. But it's more than services. It's about demonstrating community support. It's about letting people know they are not alone, that there is a team here in this community willing to help them through this.
We all come together because the goal at the end of the day is make sure that our participants, that what we call them our clients, participants, and families are taken care of from a social standpoint, economical standpoint. We're talking about substance misuse, of course. We want to make sure we're addressing that. Again, that's why we have things such as the harm reduction kits, such as the Dexterra, the fentanyl strips, the Narcan, things of that nature. And then from a mental health standpoint, it's how to We are also providing individual therapy services for individuals, family counseling services, as well as peer support groups as well too. So once we do that, it allows us to help other families. And then it's typically hey, this was going on. This person needs a referral, and it kind of starts the process. So that now it's not only Inspire to Rise, it's different agents that can come together that can assist those families.
Nassau County is big, 726 square miles. Services have to reach the people because for many, traveling to them just isn't an option. In rural areas like Callahan and Hilliard, resources are often limited due to long travel distances or lack of transportation. That's why it's so important to meet people where they are, whether that's Fernandina out east, Yulee in the center, or anywhere in between.
If we're able to provide additional services closer to them with our mobile response team that is able to go out there for the mental health aspect, the substance abuse aspect, and then get them referrals for medical supports, which are so needed for these moms, whether they're actually pregnant or postpartum.
We have a mobile unit that goes out in the community for the people that can't make it to us, that are in places like Hilliard that are too far away from our Callahan office or maybe our Fernandina office. We're starting to go out to them in the community to make sure their medical needs are satisfied. We work with a number of partners like Rebel Recovery and CCA, is Nassau County Coalition, to kind of provide services in the community as far as Narcan, do things for the children, and kind of touch all bases throughout the family.
Giving out baby bags, harm reduction supplies, diapers, regardless of things that you need, that we partner to make sure that we kind of get those resources that you need, as well as some people also provide case management services as well too.
Sometimes an RCORP-NAS partner is asked to respond to a crisis, maybe a Baker Act response or other scenario. If they find a pregnant mother or a child impacted by NAS, they're empowered to help them get the services they need through the program.
I do the STARS program in the high school, and sometimes we get our co-responders or our therapists called to school for Baker Acts. We kind of make sure when somebody goes out, somebody follows up as well as possible. So we had somebody be Baker Act at the school. One of our care coordinators went out there, met them. I got a Brave referral, and that child started services. And periodically, somebody will go check on the child if they don't come into the office and make sure they're okay, or make sure the family's okay and they have everything that they need for the person to succeed. So it's not just one person. Everybody kind of has their hand in it, like as a team, making sure the individual is met all the way around.
And it's not just the schools. It's the community too. The teams don't wait for someone to ask for help. They reach out, follow up, and try to make sure no one falls through the cracks.
My name is Christine, and I am a behavioral health therapist, and I work with the mobile response team. We arrive at the location, we talk to them and find out what their specific needs are and for their specific situation, and we offer them resources that might be in the area or, offered to them for what they might be dealing with, and we connect them with the best suitable resources that they'll need to help them get through whatever situation that they're currently going through, and we'll get them connected to maybe medical doctors, mental health counselors, and sometimes they need help with clothing at times, food assistance, even shelter at different times. And so we'll try to get them connected with those resources.
It goes beyond the initial response. Recovery is a long-term process, and the program helps connect individuals to vital peer services to help them work through their challenges with other individuals who have been down similar paths with similar experiences. These peers are people who truly understand because they've walked the same path. This kind of connection builds trust, hope, and real lasting strength to face the challenges ahead.
Peer services are essential because they can help an individual feel comfortable and more confident in their recovery process. because a lot of our peers have gone through similar situations, so they can know that they're not alone in the recovery, and they can be an example for them to know that it is possible for them to have positive results.
The goal is results, to help individuals overcome their addictions, to reduce the instances of neonatal abstinence syndrome, and help families and individuals heal.
It's been a big impact in Nassau County because we've already seen people come in, getting services. They're excited about it. We're also doing substance misuse groups, so they're knowing more about it. Also, too, we have a lot of partnerships that we're working on, trying to build out and grow it. As far as in like the supports, as far as in just the from we giving like baby bags out, we're giving out a lot of harm reduction supplies such as Dexterra, Narcan, of course, as well too. So it's been a big impact, and we're just excited about what we bring into Nassau as well, too.
Beyond the crisis response and prevention efforts in place for adults, the program has services in place for kids as well.
Early childhood, we actually have therapists that work with children. We actually have the child welfare program that Starting Point also offers as well, and that deals with the parents and the children if DCF are involved. We also have case managers and care coordinators that deal with children, as well as peers that deal with children. We go to schools, my team and myself, and we teach 3rd and 4th graders of Nassau County. And what we teach them is Botman life skills. That is a curriculum that is designed to help them with substance use in the future. It helps them with decision making, how to be assertive, how to be okay with saying no, and letting them know that there is peer pressure out there and they may run into it later in life. And it's okay to just kind of say no and do your own thing.
Prevention is a key part of the RCORP-NAS effort, including helping individuals with family planning and helping them break free of addiction through harm reduction.
We try to prevent even with the pregnancy. So my team, the prevention team, actually distributes condoms and Narcan to kind of help with the substance misuse. Also, we have services for when they are pregnant. We do carry things like Suboxone and other medications to help while they're pregnant because it's dangerous to use. We're not going to tell them not to use. We believe in harm reduction versus abstinence because it could be harmful.
Supporting our community isn't just about offering services. It's about changing how we think and work together. As Susan said, the goal is to identify the gaps in rural healthcare and fill them through strong partnerships.
Our driving purpose is to ensure that all individuals in all rural areas have access to healthcare, and our driving initiatives are to identify gaps in those areas and come up with ways through the Rural Health Network and a consortium of partnerships to be able to address any and all of those gaps. It's really those organizations like Starting Point Behavioral Healthcare, Inspire to Rise, the Community Coalition Alliance. These folks are the ones that really do get the benefit of seeing their work affecting change and a positive outcome.
Still, even the best care can be out of reach if stigma gets in the way. In the next chapter, we explore how this team is breaking down those barriers too. Stigma doesn't just silence, it isolates. It turns moments of vulnerability into shame, which keeps people from getting the help and support they need. In rural communities like Nassau County, where everyone seems to know everyone, that stigma can be especially heavy. When it comes to mental health and substance use, misunderstanding often fuels judgment. That's why part of the RCORP-NAS effort is about more than services. It's about changing minds, opening hearts, and offering people the grace they deserve, the grace they need to get on the path to healing. Kathy Moore explains how that stigma can exist throughout a community and can even find its ways into hospitals, classrooms, even within helping professions.
Stigma shows up in community settings and also in professional settings because people don't understand sometimes the mental health or the substance aspect So when you don't understand something, you're going to judge it. You're going to come across derogatory. People are not going to show other people grace for something they don't understand. So helping them understand by education, then they can give grace.
That's why education is central to this mission. At the core of real change is understanding. When we grasp the reasons behind someone's struggles, it opens the door to empathy, not judgment, and creates a space for true support. Marcus Hill explains how breaking down stigma through education and honest conversations is key to helping people see that substance use isn't a life sentence, but a challenge that can be overcome.
We will still continue to try to work on eradicating that stigma from mental health as well as substance misuse. I think it's a lot of people judge individuals if they use substances. And that's one of the things where I think we were trying to make sure we eradicate. But at the same time, too, I think it's big on educating people about what's kind of going on so they can kind of know, hey, just because a person has been using substances or we had a substance misuse disorder, that's not the end of the road. It's not a life sentence kind of thing. So I think that's why it's big on the education part of it. But at the same time, too, talking to people about it and being more exposed to it. Because a lot of people kind of, like I said, shun their nose up again because they really don't know what's kind of going on. So once you explain it to them and educate more people about it, I think it's just a matter of time where it can eradicate that stigma and we can help more people.
Sometimes changing perceptions starts with something as simple as the words we choose and the materials we share.
We make educational resources and materials. We make sure that everything from start to finish on those materials is really friendly. We make sure that the message is readable from the font size to the font type. We make sure that the information is chunked so that way it's easily digestible, yet no one feels like they're being talked down to. When your materials are like that, you're able to take in the information, process it, and know what you need to do. And the most important message is that it's okay to ask for help, that there shouldn't be a reason why you can't ask for help in today's age. So we make sure that people feel comfortable and understand the information and know that it's okay to ask for help.
Breaking stigma also means confronting the myths that keep it alive. Even when resources are accessible and information is clear, the deeper challenge is often what people believe. Misconceptions about who struggles, why they struggle, and what recovery really looks like can shape attitudes long before someone ever asks for help. As Flora Davis explains, these assumptions can shape how people are treated long before they ever ask for help.
Some common misconceptions are that people chose this lifestyle, that they're always going to be like this, that they're never going to get better. But really, it's just one moment in their life. And do we really want to define people by one moment that they are not proud of? I know that I'm not proud of certain moments in my life. And I'm thankful and grateful that those moments have not defined me forever, that I've been given the opportunity to become who I am today, and that I'm still afforded the opportunity to grow, to expand in new ways, to help people. And I think everybody should be given that opportunity.
But it's not just the public that needs to re-examine its assumptions. Even within healthcare, stigma can still show up in attitudes, in language, and in the way care is delivered. Kathy Moore has seen how that plays out and why it has to change.
Even with healthcare, you still have healthcare workers that don't understand mental health. So, they still use derogatory terms like that person's crazy or their behavior is just different things. So you find it in healthcare and you have to talk to that person because they don't know either. Sometimes you have to educate the staff within so they understand, hey, this person is not just doing it for attention. This person needs help and this is what we're here for. So if we're not showing them grace, the community is not going to show them grace.
Change doesn't happen overnight. It takes time, patience, and persistence to shift how a community talks about substance use and mental health. But Flora Davis says the progress is real, and it's showing up in conversations that look very different than they did just a few years ago.
The changes are very gradual, but they're changes. At the very beginning, nobody really wanted to work with us. They were terrified. But now we're getting flyers out into the community and people are taking those flyers. And it's just, even if it's a minuscule step, it's a step, and it's a step in the right direction.
But even as progress takes hold, deep-seated beliefs still linger, especially when it comes to substance use. Kathy Moore sees it all the time. Families and communities beginning to understand mental health, yet still struggling to talk honestly about addiction.
The community is getting a lot more education versus what they thought about mental health or substance use. We're out there in the community and we're educating people where they thought, oh, not in my county. There's not mental health diagnosis. There's not substance use. It's still something that we're battling with, as far as the substance use, because the mental health side is more recognized versus the substance use. People are still thinking, oh, we don't have addicts here. There's not people that use drugs. And you kind of have to educate them. There's different things that make people turn out how they are, and we have to meet them where they are.
It takes time to shift culture, but with every flyer posted, every class taught, every conversation had, the silence surrounding mental health and substance use gets a little bit quieter. As we've heard, no one should be defined by their hardest moment, and no one should be afraid to ask for help. Still, fighting stigma isn't just about public perception. It's about making sure the people who provide care, our nurses, doctors, case managers, and peers, have the tools, training, and awareness to meet individuals and families with compassion and skill. In the next chapter, we explore how the RCORP-NAS team is equipping providers to be part of the solution. Providing care in rural communities comes with a unique set of challenges. Limited resources, fewer providers, and tight-knit populations where privacy and stigma can make it harder to reach those in need. That's why one of the RCORP-NAS program's key priorities is equipping healthcare professionals and community partners with the tools they need, not just to provide treatment for those in need, but to meet people with compassion and understanding. Susan Gritch explains why this type of specialized training is so essential in rural areas.
Rural communities have their own issues with barriers. One of them is there are healthcare provider shortages. And so all healthcare providers within a rural area need to, be knowledgeable about how to deal with rural communities, which are traditionally more close-knit, et cetera, than other communities. They also need to be taught how to address the stigma of substance use and misuse, substance use disorder, et cetera, with people in rural communities. And so one of the things that we want to do is actually provide training for these healthcare providers and community organizations that would treat folks with any of those issues.
Training healthcare providers is only part of the equation. Education also needs to reach families, especially parents, so they can better understand the impact of substance use and the role that safe housing, nutrition, and support systems play in recovery. Ann Schrouth has seen how knowledge can empower not just moms, but entire families.
As we continue with building and creating educational opportunities for people, and particularly the moms in general, they're learning a whole lot more of how much the substance use might have impacted their pregnancies. And so they are learning a lot, and they're also learning a lot after the fact too, and how much nutrition is involved and safe housing. And there's so many different aspects of it, but it has had a huge impact on a lot of our families, and being able to have more knowledge has helped a number of particularly young kids.
Education isn't limited to doctors' offices or support groups. Through care coordination and case management, the RCORP-NAS team is also reaching young people directly, connecting with them in schools, and helping them build awareness and resilience early on. Anne explains how this work is already making a difference with the next generation.
We do have care coordination and case management that goes into some of the schools in the area. So they're providing some good education there, which is very helpful for the younger population too. But yeah, education is one of our biggest tools that we utilize.
Education is critical, but so is honesty. Healing takes more than resources or knowledge. It takes courage. As Marcus Hill reminds us, the first step to recovery often begins with telling the truth about your past, your pain, and what you need to move forward.
In order to heal, we got to reveal. So we got to kind of go look for it. We got to kind of go dig out. And the stuff that's done in the shadows and everything as well too. It will come to light, but we got to just go to it. So it's okay, but we can get the help.
Best practices don't stop at the clinic door. In a rural community, care works best when it's collective, when schools, nonprofits, hospitals, faith groups, and families are all pulling in the same direction. As Susan Gritch explains, that kind of collaboration is already happening, and it's the key to lasting impact.
There are many organizations in the community that are already serving individuals and families related to neonatal abstinence syndrome. And so the broader community is encouraged to get involved as well to reinforce those efforts and to basically strengthen the partnerships that exist already and increase and add new partnerships so that all of these folks and organizations can collectively work with one another to leverage their resources so that they have a greater impact in a rural community.
No one can do this alone. It truly takes a village. The sheer scale and complexity of the problem demands a shared response, and every voice, every perspective matters.
The problem is really big, right? And for any one person to try to tackle it, that would be so incredibly overwhelming. Impossible, really. It's so important to get many different organizations involved because they each bring a different perspective.
As a community, we should all be working together, and we should be caring about one another. And if we all do pitch in, it will make the community as a whole better.
At the heart of every best practice is a simple truth. People need to feel seen and heard, not judged. Behind every referral, every diagnosis, every recovery story is a person reaching out in their most vulnerable moment. Flora Davis reminds us how we respond in that moment matters most.
Just to be kind and gentle. Remember that a person who's asking for help, they really need it. Whatever it took for them to get to that moment to fully ask for help, that's huge. It may not be their best moment right now, right? So it's just one moment though. Should that one moment where you possibly messed up be defining you for the rest of your life?
In rural communities, connection is everything. And while those close-knit ties can make stigma harder to overcome, they can also be the key to changing the narrative, if the right partners are working together. Susan Gritch shares why growing those partnerships is essential for real, lasting change.
Growing partnerships and community involvement is so critical in this initiative because, again, with rural communities, they are close-knit communities, and that can be a good and a bad thing. So if there are additional partnerships created that work together to communicate effectively to these rural communities and basically meet them where they are, whether it's live, work, or play, and communicate effectively and educate effectively, then it's kind of a domino effect. There's additional communication, there's a wider net is cast, and it reinforces things like avoiding or doing away with the stigma associated with accessing services for substance use disorder.
Building partnerships isn't just about expanding reach. It's about sharing the load. Flora Davis explains how every new voice strengthens the work and makes it more sustainable.
It's really important for new partners and the broader community to get involved because each one of them can bring a new perspective, a new solution to help with the problem. And if everybody pitches in, the load becomes lighter on everyone, which means that we can reduce burnout, which means that we can help more people.
Collaboration isn't just a strategy, it's a commitment to making sure no family falls through the cracks. As Marcus Hill reminds us, it takes more than one provider to lift up a person. And as Flora Davis sees it, the impact of that support goes far beyond the present moment.
It's a collaboration. We're big on partnerships, so it's not only just one thing that we do as far as, trying to assist one person.
The reason why it's important is because every child has that option to be something bigger, better than the last generation. And if we don't give those children, those parents to help support and grow that child, that opportunity to be bigger and better, what have we lost? So that future child, that future adult could be the person who cures cancer, who cures AIDS, who comes up with the next biggest, greatest idea. So why not give everybody that opportunity to experience that child's growth and progress?
The best practices we've seen in Nassau County aren't just clinical protocols or policy checklists. They're rooted in partnership, in trust, and the belief that every person and every child deserves a future shaped by hope, not hardship. And while the work is ongoing, the impact is already being felt. In the next chapter, we look at the lives that have been changed and the people behind those changes. Behind every chart, behind every referral, behind every community partnership, there's a story, a person, a family, a life that could have been lost, but wasn't. For the people doing this work, the impact isn't theoretical. It's not measured in numbers or outcomes. It's seen in the mother reunited with her children, in the teen who chose a different path, in the neighbor who got a second chance. These are the moments that matter. And for the team behind the RCORP-NAS program, they are also what makes the work so deeply personal. Susan Gritch begins with what draws her to this work and the power of lifting up those who are too often left behind.
I think the thing that draws me personally to this work is that our focus is on, rural populations, but the main thing that they all have in common, our focus, our target, is vulnerable populations, the underserved, the uninsured, the underinsured. These are the folks that can fall through the cracks. And so by having the St. Johns River Rural Health Network get together and, provide funding to these community organizations, we are actually able to affect change because we help support these community organizations, these providers. They are the subject matter experts. And so it's very fulfilling to be able to actually do something and see a positive outcome. Because without these initiatives and this sort of funding, these community organizations and providers would not be able to reach as many folks as they would with it.
That sense of purpose runs deep across the RCORP-NAS team. For Ann Schrouth, it's personal, shaped by decades of walking alongside women facing some of life's most difficult challenges. What keeps her going is the belief that even one life changed makes the work worth doing.
I have worked with this priority population for close to 20 years. This is a population that I really just hold near and dear to my heart, working with women who obviously are struggling with substance issues, financial issues, housing issues, and mental health issues. And so if we can help one person see that the community cares and that we care as practitioners, and we can help them with some other services to make a difference, that is just, it's amazing to be able to see the growth of some of the women that I work with and the changes they've made for themselves.
For many on the front lines, this work is more than a profession. It's a calling. Marcus Hill has seen what's possible when someone chooses hope over despair. And he's felt the impact of those changes not just in his clients, but in himself.
I love working in this field. It's been beneficial as a therapist. I tell my clients when I work with them as well too, the therapy kind of goes both ways, honestly. As I pour into them, they pour into me. So it kind of helps me out a lot. Also too, just being able to change somebody's life, honestly, from seeing a person who's been severely depressed, who've had suicidal ideations, who've had an actual plan on wanting to commit suicide, talking them through it, helping them deal with positive coping skills. But then on the other side, from a substance misuse diagnosis, individuals who've been using substances and stopped using substances and maintain sobriety and now using positive coping skills instead of going to the substances, it's just rewarding.
Those rewards aren't abstract. Marcus has seen firsthand how the right support, delivered at the right time, can change everything for a parent and child. He shares one story that reminds him why this work matters so deeply.
I was doing therapy in the actual home where I was going in and seeing the family members. And because of this individual I'm thinking about, had an open DCF case. And when we first came in, this individual I'm thinking about, it was an open DCF case because it was a substance exposed newborn. And by working with her in individual therapy, providing peer supports in the home, she was able to actually stop using drugs. Her child was actually better.
The challenges families face aren't isolated. Substance use often overlaps with housing instability, food insecurity, trauma, and more. Anne shares a story that shows just how many hands and hearts it can take to help a family find solid ground.
In the last few months, I've been working with a mom who has 4 children, essentially lost custody of 3 of them, was pregnant at the time. When she came into services, she was referred to us by the Department of Children and Family Services. She was really struggling with a substance abuse issue. And through the work that we did with the Department of Children and Families, we got her into services here. She began therapeutic services, entering into a lot of our group processes. We worked really hard with her whole family, including her mother and a stepfather who, and together we were able to kind of really rep services. So we had peer support involvement, care coordination involvement, and case management involvement, as well as the therapeutic supports that she was experiencing. So we really work hard in making sure that we can meet those needs, as well as food sources. I mean, a lot of times these families don't have food, so we get them connected with food banks and to help them find the ways to kind of find out what resources are in our community.
Recovery rarely follows a straight line. It takes tools, training, and trust. It takes a team. Kathy Moore shares one example where that team effort didn't just support someone's recovery. It saved their life.
Recently, we just actually had a call on one of our peers that the person is in recovery. They go to groups at Starting Point, but they also, had Narcan training with myself. They met with the case manager, and the parent just kind of called to let us know that we were actually doing a good job with this person because their recovery is actually going well, and that Narcan actually saved the person's life. So that was like a team effort. It wasn't just one person. They went from jail to the community, and they're thriving.
Not every turning point comes in a single moment. Sometimes healing begins with one small step and someone willing to walk beside you through the rest. Christine McClure shares how consistent support helped one mother find her way through a difficult chapter.
There was a woman that was going through postpartum depression. She had just had a baby that was approximately 2 weeks old, and she was having a really difficult time. And I followed up with her several times and got her some assistance and got her to come in for some counseling and some therapy. And after several months, she was doing a lot better. She got the help that she needed and connected her with a lot of resources that were in the area that she was unfamiliar of. So that really helped her a lot.
Change can be hard to measure until you see it on someone's face. The moment a parent chooses a new path, the moment a person starts to believe they're worth saving. For the people doing this work, those moments are unforgettable. Anne Schrouth and Flora Davis describe what it feels like to witness real transformation.
To be able to work with somebody who came to me the first time, maybe that was pregnant, had been using directly while pregnant, and to know that they've made that shift or change. They've come to us to say, I want something new and different for the baby, or they might have other children too, so that they want to create a change. That's what we're here for. And to walk alongside them is a very powerful, powerful moment. And when I can see the changes they make, that is extraordinary. That is just, to see the changes and how they light up and feel that they've made a choice that's different and an action that's different. And then they can create this whole new life. It's a beautiful thing to watch.
You see the one person who may have had no hope. They smile that day. And that's so much better than where they were. Mental health issues, that deep despair, you're in a dark black hole. But when you start to finally get the help that you need, there's a light at that end of the tunnel. And you start to breathe again. You start to have hope. You start to care. You want to wake up in the morning. And really, that is the best thing that you can help with somebody else, is to give them that hope. Because the world's kind of dark these days. And if we can all carry just a little bit of hope, it could get better.
Seeing change happen up close, especially when someone fights for it, does more than inspire. It fuels the work. Marcus and Anne share how those moments continue to motivate them day after day.
When you see somebody come from the bottom and then work themselves up and put in the actual work for per se, it's just enlightening. And it honestly continues to motivate you to continue to do more, because there's a lot that needs to still be done.
There are a number of things that keep me motivated. My love for the work itself, working for women and providing them some information, education, but also the idea of seeing what they can do motivates me every single day.
For some, the motivation comes not just from what they've seen, but from what they've lived. Kathy Moore's journey brings a unique perspective to the work and a deep sense of compassion for the people who walk through the door, ready to start again.
I'm actually a peer. So a lot of people don't know that I'm a supervisor, but I'm also a peer. So coming from Philly to down south is a big change. So if you can make a little change in a town like this, you can go further. You just want to help people because you've seen where people could be or where you could be. So it's beneficial to kind of help somebody and show people grace. When a person comes in for services, you know that they're ready to start new. They're tired of the past and what they've been dealt.
No one chooses this work because it's easy. The stories can be painful, the setbacks real. But behind every struggle, there's still love, still potential, still someone worth fighting for. That belief that every life is worth showing up for is what keeps the RCORP-NAS team coming back, even on the hardest days.
When you hear a story of a mom losing a child and losing parental rights, that's a hard day. I know that a mother loves her child no matter what. And when you're dealing with addiction issues, very, very hard. A lot of people have a hard time understanding how a mom could use a substance when they're pregnant or when they are caring for children. And a lot of times they don't feel like they have that choice. It's wrapped up with mental health issues. That becomes a very difficult scenario. But when we're here and we work every day, and even when people fall down a little bit, we also are here to pick them back up and say, you can do this. That's the motivating factor. I mean, we're just here and we keep trying.
What keeps me motivated to do this work is that it matters. Every day you get up and you wonder, how can it all get better? The world is such a hard place. Whether it's natural disasters, whether it's riots or protests, what can I do to make the place a little bit better?
In the face of big challenges, it's easy to wonder if one person can really make a difference. But as Kathy Moore and Flora Davis remind us, sometimes helping just one person is enough to change everything.
If I help one person, I'm making a difference. You don't have to help a million people. One person is all it takes.
If I can write one grant, if I can help one person to stay employed, to be able to help others, that means that person can help a caseload or several individuals to have and achieve a better life. Think about the ripples then. And if you can help just one person, isn't that what we're supposed to do? We've left the place that much better.
The people doing this work aren't just delivering care. They're bringing their whole selves to it. For some, it's about creating the change they once needed. For others, it's about paying forward the hope they've found. Marcus Hill and Christine McClure explain what keeps them going.
What keeps me motivated on the hard days? Realize I'm not doing it just because it's just for me. I'm looking at a bigger picture. I'm on a larger scale. I'm not just doing it just for me. I represent a company who really inspires to rise people to rise. And I really enjoy mental health. I enjoy knowing how to help somebody else, because I used to be there too, where I needed that motivation.
Because of my own lived experience from my childhood trauma and other situations that I've been through, I feel like if I had had the support when I was younger, it probably would have saved me a lot of heartache myself. So I feel that I'm able to help others by, my own lived experience and, with having empathy towards others.
For the RCORP-NAS team, the impact isn't just in the individual stories. It's in knowing the system doesn't have to stay broken. Susan Gritch shares how this work brings together the right people and the right resources, and what it feels like to finally see change take root.
These issues with these populations and their inability to access health care is very, very disturbing, and there are ways to fix it. And so we're able to actually work in an environment where we see a need and we can address it. It might not be us directly, it might be a provider, etc. But we actually see that there's a need exists, and we are able, through leveraging one another's resources, to effectively address it. I mean, it's positive feedback. It's very, very motivating.
These are the faces of change, the people behind the scenes and on the front line, helping others find their way forward. The impact of this work is real, it's personal, and it's only possible because of strong partnerships, shared purpose, and a commitment to meet people where they are. This video isn't just about telling a story. It's about starting a conversation. For every person facing this journey, for every parent, partner, or loved one. Sometimes the first step is simply knowing you're not alone.
I hope that this video also provides a communication vehicle so that hopefully someone who maybe they or a loved one is experiencing issues with neonatal abstinence syndrome, and that they would look to this video as maybe a first step to know that, we are there, our partners are there, and hopefully speak to them and maybe eliminate some stigma associated with it, and know that we're here to help, not judge, and that we support the community, and all we want to do is really help the community.
Support is where it starts, but the only way we move forward together is by continuing the conversation. Talking openly and honestly about addiction, mental health, and recovery isn't easy, but silence never leads to healing.
We got to continue to talk about these things that are not often talked about, or these taboo subjects. And again, like I said before too, in order to heal, you got to reveal. So we need to talk about it. We need to address it, because what happens is the more people know about it, and the more people are educated on things, the easier they become. I'm big on trying to eradicate that stigma from mental health to substance misuse.
Conversations break the silence, but compassion is what carries us forward. Because even when the road feels heavy, when fear, shame, or uncertainty try to take hold, what matters most is knowing someone is walking beside you, that there's a community of people cheering you on.
Most importantly, you are not alone. Is the journey scary? Is taking that first step scary? Yes, it is. It may even feel extremely overwhelming from time to time. You are not alone. There are so many people here who may be working behind the scenes, who are there to take every step with you.
Behind every story in this video, behind every phone call answered, every hand held, every life changed are real people. This is the team doing the work.
My name is Susan Gritch, and I am the Executive Director of the St. Johns River Rural Health Network.
My name is Kathy Moore, and my title is a Prevention Supervisor.
I am Flora Davis. I'm the Grants and Programs Administrator.
My name is Marcus Hill. I work for Inspire to Rise. I'm a program coordinator with Inspire to Rise. I'm also a therapist as well, too.
My name is Christine, and I am a behavioral health therapist, and I work with the mobile response team.
My name is Ann Schroth. I am a behavioral health therapist with a primary focus on working with clients that have been referred to us from the Department of Children and Family Services. Primary focus on substance use. I love the work I do.
The challenges are real. The work is hard. And when it comes to neonatal abstinence syndrome, the pain runs deep for infants, for parents, and for entire families. But the impact of this work on futures, on healing, on whole communities is undeniable. If you or someone you love is struggling with substance use or the effects of NAS, don't wait. Reach out. Help is here. You are not alone. And if you're ready to stand with us, whether by volunteering, partnering, or sharing your own story, there's a place for you in this movement. Reach out to the St. Johns River Rural Health Network, and they'll connect you where you're needed most. This is real work, and it is creating real change. Because when we meet people with compassion, not judgment, when we come together in hope, we don't just shift outcomes, we transform lives.